Bella Vista Community Television presents Senior Happenings. Today our host is Tricia Ayers and her guest is Amanda Kinyon. We will be talking about nursing homes, specifically Rogers Health and Rehabilitation Center. And now to the studio for our program.
Well, hello everybody and welcome to Senior Happenings. I am Tricia Ayers. I will be your host today and we are talking about nursing homes. Not everybody's favorite subject sometimes, but we need to be informed and educated and we need to know about the wonderful nursing homes that we have in our area because we do. We're very, very fortunate. And to help me with that subject today is Amanda Kinyon, and she is the administrator for Rogers Health and Rehab. So Amanda, welcome to the show.
Thank you.
Thank
Good
you
morning.
so much. And it is. Nobody wants to talk about nursing homes, but we need to talk about it. We need to educate people, and we need to know about, and we do have wonderful places in our area, and yours is definitely one of them. And well established in the community, Rogers Health and Rehab. How long has it been there?
Ooh,
quite a few.
Since the 70s.
Yes. It's an established,
It's been there for a while.
And please tell us a little bit about your journey becoming the administrator. Where did you start and how did you get to be an administrator?
So I've been in long-term care since I was 18 years old. I started
Just a few years.
Yeah, I started as a CNA and worked my way up. I actually went to therapy school and was a physical therapist assistant for a while and then decided I wanted more of a challenge. So I became a nursing home administrator. I've been a nursing home administrator for around 6 years.
Congratulations.
So, thank you.
That I think some people don't realize that being a nursing home administrator is you're really on call 24/7.
Yes.
Everything comes to you.
Yes.
If something happens when you're not there or somebody has an issue, you are contacted, correct?
Yes, ma'am.
You are 24/7. That
Yes,
is
ma'am.
that is a big commitment. A big, huge commitment. So let's talk about Rogers Health and Rehab. How many patients do you have there?
We have around 70.
70.
We average about 70.
70, okay. And so people come for the nursing home portion, but they can also come for a shorter stay for rehab, yes?
Yes, ma'am.
From a hospital. What kind of things do you rehab at Rogers?
We do a lot of strokes, heart attacks, general deconditioning. You know, of course, with COVID, we've seen a lot of different side effects from people having COVID and things like that. And so a lot of that coming in. We can do physical, occupational, or speech therapy there. But there's not anything really that we couldn't rehab as far as a diagnosis goes.
Okay, and how long is usually rehab? I mean,
I'd say the average length of stay is around, for rehab, is around 17 to 21 days.
Okay.
So they just stay short term, and some people is shorter than that, and some need longer than that.
Okay. So if somebody comes in, I'm kind of going off script here.
Sure.
Somebody comes in for rehab, but then we realize that going back home is probably not a good idea. Is it a smooth transition to be part of the nursing home program at that point?
Yes. So whenever somebody's coming to the nursing home, we get a referral. I mean, we start discharge planning day one if we know that they're going to be short term. So we would start asking them, you know, questions about secondary insurance or, you know, already about their insurance, see what their plans are, have care plan meetings with that family frequently so that we can give the family an update on they're still needing help with this, they don't need help with this, but we still recommend that they, you know, have care for this many hours a day, or maybe, you know, it's not realistic that they might return home because they are needing 24-hour care. So the transition there is very easy. We are in communication from day one from them admitting into our facility.
And what people need to realize is it's not about the nursing home going, oh, well, we just want to keep you so we can have money. It's about the best interest of the patient.
Yes.
Whether going home is a good idea or whether going home is not a good idea. And sometimes it's not a good idea. It really is. And we deal a lot with that in our office, that people want to be at home, but their best care is going to be in the nursing home.
Yes.
It really is. So let's talk about age ranges of your residents. What's your youngest?
I would say 25 years old. So
25?
We have anyone from anywhere from 25 to 100 years old.
Oh my goodness,
So,
that is a wide age range.
yes.
And so one of my questions was, can you keep your own doctor, your own primary care doctor, if you come
Yes,
into a
you are
nursing
able to
home?
keep your own primary care doctor. However, it is encouraged that the medical director, even the medical director will encourage to, your own doctor might encourage you to utilize that medical
Sure.
director because they are a geriatric specialist. They know about the facility. They know what the facility can handle as the medical director. And, all those records from your doctor, as well can be pulled, and with all the electronic health records, we can get all the information from
Yes.
your own physician, but they are able to have the right to choose the physician that they want to see.
Good, that's great, because I think that's a question that some people, they're very attached to their primary care doctor and don't want to lose that. And as you said, most of the time the primary care will go, it is better to switch care
Yes.
to the person who, is in charge of the facility
Yes.
there. So tell me about staffing, and also you talked about CNAs. That's where you started. So I'm sure you have CNAs there.
Yes.
And then what are the other acronyms that you have on staff in a nursing home?
So for the nursing care, we have nurses assistants who just recently have went through a CNA class but maybe haven't sat for their certification. And then we also have certified nursing assistants, licensed practical nurses, and registered nurses.
Okay.
Recently now we are able to allow medication assistants certified into the nursing homes. So we have sent some of ours. They just started a class on May 20th. So that would act as a medication tech, as some
Right.
other states, recognize them as. And so they can be able to pass, some of the medications within their scope.
Sure.
So, any Tylenol, blood pressure medication, anything that doesn't necessarily need to be monitored
Right.
by a licensed nurse, although they are supervised by a licensed nurse while doing that.
Right. And RNs and doctors, are they on call? Do they have their own does the doctor have his own practice and he comes into the nursing home when needed, or does he have hours?
Our medical director, she only does nursing homes. So
Okay.
she only goes to nursing homes. So our medical director is at our facility at least once a week. And then we have a nurse practitioner that is there 5 days a week, and they're available by phone, all the time. There's a whole crew. So even after hours, they're available. So we can always get a hold of a nurse practitioner
Right.
or physician if needed.
Excellent. Good deal. So would you encourage people, I know nobody wants to do this, can you pre-tour a nursing home? Can you come in and see what is in a nursing home?
Absolutely. So
Okay.
for us, we are doing pre-tours. We actually encourage that. That gets you not only to see the facility, meet the staff, but it helps us to understand whoever the potential resident is that might be coming in, so
Right.
that we can really communicate with them. They can ask any questions. I mean, the transition into a nursing home, whether you're coming from home or you're coming from a hospital to rehab for a short-term stay, I mean, what we find is it's a lot of information thrown at you, and if you aren't in the healthcare field, or you haven't worked in long-term care, and you don't kind of, it's not just kind of natural and you know how it goes, that it's a lot of overwhelming information. So you have, the hospital throwing information at you, and then you come to, the nursing facility and they're throwing information at you. There's paperwork and everything that has to be done there. And so it's really good to do a tour so that you can ask any questions up front that you might have.
Right.
To kind of pre-prepare for anything that could be coming.
Absolutely. Location is sometimes important for people.
Sure.
That's important. And also, I totally agree with you. Take a tour and see what the atmosphere is like. Don't judge a book by the outside of the building. We also talked about that. We have some really fancy schmancy places. We have some established places. Please go in, even if you're not in the market for a nursing home at this present time.
Sure.
The information that you get there will be great information to pass on to a neighbor, to a loved one, to somebody at church, that you've had that practical experience.
Right.
So you briefly mentioned about COVID. How is your facility doing after COVID?
We're doing good. So the CDC also and the state guidelines, of course, they're ever changing. So all the employees are still we're still wearing medical masks. But we can allow visitors now. They really encourage, the CDC and the state recognize how important it is for everybody to be able to visit their loved one, because it was on lockdown and restriction for so long, and it was, very heartbreaking for the staff and the residents. And so we are open. We encourage visitors. It's just a simple screening process, a series of questions, take your temperature, and you're able to go in and visit your loved one. So
good.
Almost back to normal. But
Good. Touch wood.
Right.
Touch wood. We like that. And I'm sure you like visitors in the building too.
Oh yes. We love it. And we love to see, the residents smiling and everybody smiling, and that their family gets to come back in, and we get to do, like I said, get back more to those normal routines of us, being able to have activities in big groups and dine together again, So
Right.
that is very exciting.
So one of my questions was hospice care. Do you do hospice care in the nursing home? Do you have like Circle of Life or
Yes.
the other companies come in
Yes.
and do hospice care?
Yes, so we have several different contracts. We with several different ones. We have Circle of Life. I know we have Washington
Yes.
Regional Hospice as well, and so we are able to take people on hospice. We're also able to take them for a respite. So if you're caring for somebody on hospice and you need a break. I mean, it's hard to be a loved one and be a caregiver 24/7.
Right.
I've done it with my own family 2 or 3 times, and even with people rotating, and it's hard. I mean, it takes a whole team of people,
Yes.
to care for that person. So we can do respite, we can do hospice there. We provide all the same services, and then the hospice provides additional services as the hospice aides and nurses will come into the facility
Right.
for that resident that's receiving that hospice care as well.
That's a really good point about respite care, because I think people think that if somebody's at that level of care needed, that there's nowhere they can go for help.
Sure. Yeah, and so there is. And always, call if you ever have any, questions in general about long-term care, and we can always direct you, to where you need to go, or any resource in
Sure,
the community that could help
absolutely.
you more.
I think our community is very much like that. If we can't help you, we will point you in the right direction.
Sure.
That's a beautiful thing about our community and senior health care. I really do think so. So tell me about what can I bring to the nursing home with me? Obviously, I can't bring my king-size bed and my chest of drawers and my family portraits, but what can I bring?
Well, you can.
You
You can bring your chest of drawers and your family
Okay.
portraits. So you can bring any personal belongings that will fit within, your space. So
Right.
whether you're sharing a room or you have a private room that will fit within that space. People bring mini refrigerators, but we do encourage family portraits. So, the nursing facilities, especially ours, we really try to do person-centered care. So
Okay.
if we know somebody is coming, we would encourage that family to bring those family portraits. Let's set that room up, like it was similar to at home, so that it's something of comfort and that they know.
Right.
So really it's more what you can't bring to the nursing
Okay.
home than what you can bring.
Okay.
So no space heaters, no heating blankets, no weapons, no drugs that are not prescribed by a physician, and
Right.
of course, no illegal drugs, anything that could potentially cause a safety hazard to the resident or other residents in there. No
Right.
matches, lighters, things like that. But if it's a safety hazard, no. But most stuff, yes. We have people that bring their favorite recliner, their chest of drawers, the pictures of their family.
Good.
We even at our facility will allow them to bring their dogs for a visit, not overnight, but we
Right.
do encourage them if they have a pet, and they've had that pet for a long time. Pets
Sure.
are very important. They're good for, taking away stress and uplifting spirits.
Absolutely.
And I know we encourage them to bring their dogs to see those loved ones too as
Right.
well.
You mentioned lighters and smoking, so I am sure you have some residents who are smokers still.
Yes, yes, ma'am, we do.
And you have that nice area when you drive up. You have chairs under like a covered
We do. We do have
porch area.
We do have a covered porch and pavilion. We do have a designated smoking area, though.
Because, I mean, that's just realistic.
That is in the courtyard. And so we do allow residents to smoke.
Okay.
They go through a safety assessment to ensure that they're safe to smoke, either supervised or unsupervised.
Okay.
And we keep the cigarettes and the lighting, mechanisms all locked up. And there is certain smoking times, and they go out with designated smoking times, with the staff member, supervising if needed. So
but they can still have that time if they.
They still can, and a lot of, they're, to a lot of people that's important, and that might be one of the only things that they have left,
Yes.
and so we do have to consider that. And I mean, I think that's also goes along part of the culture change,
Absolutely, absolutely.
I always said when I was younger that, in 5 years, we wouldn't be listening to Elvis in the nursing homes, Not that I don't like Elvis, but we wouldn't be listening to Elvis
Right.
and Patsy Cline.
Right.
We're getting to the days where we're going to be hearing, Pink Floyd and all those rock and roll bands, from that era. And
Good,
so
I
we
can't
all
wait.
have to change with the times, right?
But also talking about smoking, and I didn't ask you this question before, so we're also dealing with an era of med cards, and we do have some of our seniors that have med cards. Do you deal with that at all at Rogers
Med cards.
for smoking marijuana?
Oh, we cannot do that in the
Okay.
nursing home. So
Okay.
it is recognized at a state level, but it is still not recognized at a federal level,
Okay.
and we have to abide by federal and state guidelines. So
Okay.
unfortunately, at this time, no nursing home
Right.
is able to do anything regarding
Right.
the medical marijuana.
Well, I know anything VA related, they will not
Right.
recognize it too.
Right.
But that it's kind of the thing on the circuit that it's coming in, and
It
there's
is.
lots of webinars and
Mm-hmm.
meetings about how to deal with it when it does get here. So we know it's heading in that direction.
Yes.
So
Yeah. And so
Anyway.
if it ever reaches the point where, federally, I'm sure there'll be a lot
Sure.
more changes in the nursing home
Sure.
regarding that. So
change, sign of the times. We
That's
have to
right.
change. One thing I did wanted to touch on that is super excited that we've been talking
Mm-hmm.
about is what is called the greenhouse model. And I did not know what that was, and then happened to read an article about it before our interview. This is such exciting news. Could you tell us what the greenhouse model is and
Sure.
what your company is doing about it?
yes, so the greenhouse model is a more home-like model, and we really utilize the motto a lot, not about me, without me. So, we really include the resident. So the greenhouse model, if you were going to pull down to a facility that was a greenhouse model, it is a nursing home, but everybody's not under one roof. So there is cottages. And so there's usually 10 to 12 people in one cottage.
Okay.
So then there's workers within each cottage. Those workers are universal. They are trained to do the cooking, the cleaning. They're a CNA as well, so it is more like if you were at home and somebody was taking care of you at home.
Right.
There's a big hearth room. There's a big, huge kitchen, big, huge dining room table for family-like dining that everybody can sit at the dining room together. All private rooms. And so that is really the main thing with the greenhouse cottages, is that it is a more home-like environment. So if you wanted to, room, of course, with somebody or with a spouse, you'd have that option.
Sure.
But it is a private room, it looks just like a house. If you were to pull down, it was going to look like a neighborhood. And so,
Do we have this in other parts of Arkansas, and
Yes.
it just hasn't reached us in Northwest?
so that yes, they are in all other parts of Arkansas. It just hasn't reached us yet in Northwest Arkansas. So there is construction being done on a greenhouse cottage concept here in Northwest Arkansas. Downtown Bentonville.
Oh my goodness.
So we don't
Should I get
have
my
a,
name on the list right now?
Yes,
Probably.
Yes. It will be more personable and smaller, location. So that will be nice too.
That's wonderful.
Mm-hmm.
So people can contact you if they'd like a little bit more information about what that
Yes.
model looks like.
Oh yes.
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 So, and we will put your number up on the screen. But that is just such exciting news, because I think we are moving in that direction where
Oh,
people
yes.
want that.
Yeah, so they're again, we have to change with the times and culture change, and the days of 2 people to a room and having a roommate and things like that. I mean, that is slowly starting to transition out.
Right.
There's a lot in the area that still do that. There's some homes in the area that are all private rooms. We offer private rooms as well, and so that is going to definitely be the culture change and part of the culture change, and I think it's going to be great.
What's the time frame of that? Are we looking 2 years down the road? A year? What do you? I know you.
I don't have a time frame at all
Right.
right now. I can't even tell you if it'd be a year or 2 years. I mean, we're hopefully soon, but I don't have a set date of anything on that right now.
That's amazing.
So we can have more on that later, though.
Yes, we'll keep up with the times there. Let's talk about payment.
Sure.
How do we pay for Rogers Health and Rehab?
So we do take Medicare, which would pay for your short-term stay.
Okay.
We do take some managed care plan.
Can we go back to that, because it
Medicare.
gets really confusing for people, even me who's supposed to know what
Sure.
this is. So Medicare, I can use that for rehab, and I can use that for some nursing home care, or just the rehab portion?
So as far as how do you pay for room and board,
Yes.
if you're going to come there for a short skilled stay,
Yes.
and your insurance is accepted at that nursing home, traditional Medicare, any of these managed Medicare plans, Humana, United Healthcare, Aetna, I mean, there's a million of them out there.
Right.
But if you're going to come there for skilled rehab and just for your short stay,
Okay.
then your insurance pays for your room and board
Okay.
there, so that you can file that on the insurance.
Okay.
If you are going to transition into long-term care, most in our building are on Medicaid.
Okay.
We do accept private pay. There is some long-term care insurance policies that we accept as well.
But check your policy really well.
Yes, and VA, and we can help pre-screen all that before somebody was going to come in. The Medicaid is where obviously it gets a little bit more trickier, because the state is saying whether you qualify or not. So you
Yes.
have to meet a medical aspect of it. So you have to require 24-hour care, require help with ADL. So you have to meet a medical aspect for Medicaid, and then
Can
you
you
also
tell us
have
what
to
ADLs are for anybody who wouldn't know?
Activities of daily living.
Okay.
So if you need help walking, eating, going to the bathroom, standing up from a chair, just getting from your bed to your chair, point A to point B, all of that is considered your activities of daily living. Combing your hair, brushing your teeth. So you have to medically meet that for Medicaid, and then financially you also have to meet Medicaid, so they will go by your income
Right.
and any assets that you have. And so we will always pre-screen that for anybody that is coming in, so that we can help go figure out the best route of how
Right.
they can afford to come to the nursing facility.
So on the rehab side, your insurance will probably cover it. Always double check everything with insurance.
Yes.
And on the nursing home side, you can private pay. You can qualify for Medicaid,
Yes.
which is a process. You can use your long-term care insurance, but you need to check the policy, because those policies can be persnickety
Yes.
of what they cover. In VA,
And VA.
okay,
Yes.
just making sure I have everything, my ducks, because I know that gets super tricky for people when
Yes.
and it gets confusing.
Yes, it does.
It
It
gets
really
confusing.
does get confusing. Yes.
Yes. And in the new greenhouse model, will that just be private pay, or will there also be Medicaid beds there?
Yes, it's all the same. So the greenhouse model is exactly like a nursing facility, nursing home as people know them. It's just a different concept. So like I said, everybody's not under one roof. There's 10 to 12 people in each home, and there's 6 to 12 homes depending on where you're
goodness.
at. So
That is exciting. Okay. I'm going to get my name down. That sounds perfect for me as I transition.
Right.
So I would like to thank Amanda. Thank you for all the
welcome.
information. We do need to know, and we do need to educate ourselves about nursing home care, nursing home care in our area. I would encourage people to reach out to a nursing home. Go take a tour.
Yes.
If it's not with Amanda at Rogers Health and Rehab, go somewhere else, but take a tour. Familiarize yourself with what is available, what you like, what you don't like. You just got to be educated. Don't let the first time you step into a nursing home be a crisis situation.
Or the, perception that you might have from years and years ago, or, nursing homes have really come a long, long way.
Absolutely.
And they really are about person-centered care, so what that person likes and what their interests are, and, how their normal routine at home. We're really trying to get back to, all of that, because it's not only a transition for the family, but of course it's a transition for that resident.
Absolutely. Okay. Thank you so
You're
much,
welcome.
Amanda. Thank you for joining us today, and we'll be back with some more exciting topics later on next month, always senior related. And once again, thank you to Amanda for joining us from Rogers Health and Rehab. Go take a tour. Go check in with Amanda. Thank you.
Remember, you can see this program on Wednesday, Thursday, Friday, and Saturday at various times. You may also view this program on YouTube.com by going to Bella Vista TV. This has been a presentation of Bella Vista Community Television.